Hello everyone. In this video, we will be discussing about sexual offenses. So, see, sexual offenses. What are the topics you have to be well versed when you sit to read this chapter? Number one, definition of rape and what are the IPC sections which deal with rape. What do you mean by natural and what do you mean by unnatural sexual offenses? What do you mean by natural and what do you mean by unnatural sexual offenses? What do you mean by sexual perversions? Okay, a lot of terminologies you will came across. You must know all these terminologies, which can be asked as a short note or as an MCQ or during a practical exam. A lot of questions you will get from this chapter, sexual offenses. I would like to do this chapter in two videos, part 1 and part 2. In part 1, I would like to discuss about the natural offenses, which includes rape, incest and adultery. Unnatural offenses includes sodomy, tribadism, bestiality. Tribadism is also called as lesbianism, buccal coitus. Sexual perversions include sadism, necrophilia, masochism, fetishism, transvesticism and exhibitionism and masturbation. And of course, frotteurism all comes under that. And sex-linked offenses, which includes stalking, voyeuring, sexual harassment, indecent assault, and trafficking. Okay, let us leave all those aside. Come to the core topic, that is rape. You must know the definition of rape, and the definition has to be told, or it should be dictated, or it should be explained the same. You have to use the same words what is mentioned in the Constitution of India. Okay, the examiner will expect you to say the same definition. A man is said to commit rape. Number 1, number 2, number 3, and number 4. A man is said to commit rape if he penetrates his penis into vagina, mouth, urethra, or anus of a woman with him or any other person. Number 2, inserts to any extent any object or a part of body, not being the penis, into vagina, urethra or anus of a woman or makes her to do so with him or any other person. Number 3, manipulates any part of the body of woman so as to cause penetration into vagina, urethra, anus or any part of the body, or applies his mouth to vagina, anus or urethra or anus of the woman or make her to do so with him or any other person. So these are the 4 components you have to explain in the definition of rape. This can be against her will, with her consent or without her consent, or with her consent provided she is in some coma or she is under some toxication state. Okay, all those things. Or when he is not able to give consent, for example under 18 years of age, or when she is unable to communicate consent, for example less than 7 years, 4 years, all those. So these are the definitions of rape. All these components comes under the definition of rape, which is defined under section 375 of Indian Penal Code. What is an exception to this? Sexual intercourse between a husband and wife is not rape. A medical procedure or intervention shall not constitute rape. For example, doing colposcopy, doing per vaginal examination, doing per rectal examination. All this does not constitute rape. Punishment for rape is explained in detail under section 376 of IPC. In that, we have section 376A IPC. Section 376A IPC. I'm just saying what is the keywords. Okay, just I'm saying what is the the punishment which comes under each section. I'm not going to say all the sentences. Section 376A means because of this rape, an injury has happened and this injury made the woman to be in a state of persistent vegetative state, or in simple words, coma. That is called section 376A IPC. Section 376B IPC means, okay, sexual intercourse with his own wife who is living separately. That is section 376B IPC. Section 376 IPC, section 376C IPC. Okay, A we have dealt, B we have dealt, C means any person in authority. For example, a doctor, a police officer, an army personnel, or a defense person, or a government official who is in authority does or commit rape, that is actually coming under section 376 IPC. What is the punishment for section 376A? Life imprisonment or death sentence. Section 376B, it is up to 7 years. And the section 376C IPC, it comes under punishment is 5 to 10 years. Fine? I told you, rape by an authority. And section 376D IPC, that means it mainly includes gang rape. That is, women is raped by one or more persons who constitutes a group or acting in furtherance of a common intention. Section 376E IPC means, which is not that much needed for you. Just remember up to section 376D IPC. Okay, fine. Some other IPCs you have to remember. Section 354A IPC, that means sexual harassment, physical contact and advances involving sexual overtures, making sexually colored remarks, showing pornography. All this imprisonment 1 to 5 years. Section 354B IPC means using criminal force for sexual assault. Section 354C IPC is voyeurism. For first attempt, it is up to 3 years. For second attempt, it is up to 7 years. And stalking, you know what do you mean by stalking? Whoever follows a woman, okay, with a bad intention, that is called stalking. Okay, again 3 years. Trafficking of a person, 7 years to 10 years. Fine? Okay. What is CRPC? Criminal Procedure Code. Section 53A of CRPC means when a person is arrested on charge of committing an offense of rape or an attempt to commit rape, and there are reasonable grounds to believe that an examination will afford evidence as to commission of the offense, it shall be lawful for a RMP employed in a hospital run by a government, okay, and in the absence of such a practitioner, within the radius of 16 km from the place where the offence has been committed by any other RMP acting at the request of police officer not below the rank of a sub-inspector, to examine the arrested person with the use of reasonable force as required. That means, in simple words, a person is accused for a rape case. A registered medical practitioner, in simple words, a doctor, can do medical examination without his permission under force. That's it. Or under compulsion. Even though the accused is not willing, we have the right to do his examination. Okay? We don't need his consent. Fine. That means the doctor has to examine the person and give detailed report. What do you mean by section 164A of CRPC? During medical examination of the victim, it can be done in a government hospital, okay, within 24 hours. And the registered medical practitioner should examine her without any delay. Okay. What do you mean by section 357 of CRPC? A girl is brought to a private hospital following a brutal rape. A private practitioner should not deny treatment for her. If he or she denies treatment for her, she will be charged under IPC. Fine? That is section 357 of CRPC. What do you mean by section 53A of CRPC? Or section 54A of IEA, Indian Evidence Act. Here, the evidences has to be properly collected. What do you mean by statutory rape? Rape of a girl below 18 years of age, even with her consent. You know what do you mean by gang rape or group rape? What do you mean by date rape? That means sexual intercourse with a woman who is given a drink which contains some sedative drug called the most commonly used date rape drug is called rohypnol. What do you mean by rohypnol? Rohypnol is the common name of flunitrazepam. Flunitrazepam is like our diazepam, lorazepam. All these are benzodiazepine group of drugs. Fine? Fine. Okay. Who can give a valid consent for a sexual intercourse? 18 years and above. Consent is not valid when it is obtained as a result of impersonation, in fear of death, unsound mind, below 18 years of age. Okay. Remember, rape can only be committed by a man and a woman cannot rape a man. Age of accused. Remember, in India, as per constitution, there is no age limit under which a boy is considered physically incapable of committing rape. Right? Means even a 10-year-old boy can rape a girl. That's what. Coming to types of sexual offences, it may be by a normal man or sexually deviated but psychologically non-deviated offenders. Sexually and psychologically deviated offenders. Sexually non-deviated by psychotic. Okay? Just leave it. Just remember these are some types of sexual offences. Fine. As far as examination of the victim is concerned, we have to do something called as a general procedure. That is, it is a medico-legal case. Inform the nearest police station as soon as possible. Do proper examination of the accused, do proper examination of the victim, prepare a detailed investigating report. Copy of the same has to be sent to the police official, that is the investigating officer, second copy to the department, third copy to the judicial magistrate. First copy to the investigating officer, second copy to the judicial magistrate, and third copy to the department. Fine? Okay. Once general examination is done, examination proper. Clothes has to be properly examined for seminal stains and vaginal secretions. General examinations, that means the external appearances, external markings, identifying marks, all has to be properly mentioned. Marks of general violence, okay, that is if in the case of a brutal rape has to be properly noted. Hair, especially the pubic hair has to be properly noted. Seminal stains and seminal stain swabs has to be taken properly, it has to be stored properly, has to be sent to the forensic science laboratory for analysis. Blood stains, any presence of any venereal disease like syphilis or gonorrhea has to be, or HIV or herpes simplex or trichomoniasis or human papillomavirus has to be properly analyzed. Local examination of the genital, the patient is always examined in the lithotomy position. Genital injuries has to be properly mentioned. Okay, remember if it is a rape on virgin, you have to examine the labia majora, labia minora and hymen. Remember, okay, if the hymen is ruptured, it doesn't mean that, or in some cases, we have cribriform hymen and all. So, rupture of hymen is not actually a marker of virginity. I have already told this in my previous video. Okay, even if the hymen is intact, she may not be virgin. Okay, fine. And then coming in, okay, you have to always think about the different types of hymen, that is the cribriform and fibriated hymen, which will actually mislead your findings. And you have to examine the hymen. The instrument we use is called Gleister-Keene rods or globes, which are glass or plastic rods with a diameter of 6 millimeter, which have a globe at an end. Okay, that is actually the globe will be heated up to the body temperature of 34 or 37 degrees Celsius, and it will be inserted through the vagina. Okay, and then we will see whether the hymen is intact or not. Okay, fine. Then we will be examining the labia majora, labia minora, any edema, any injuries, okay, any penetration marks, okay, any rupture of the vaginal walls, abrasion, bruising, everything has to be properly done, and a perspeculum examination has to be done. Okay, and as far the recent guidelines which is issued by the Honorable Supreme Court of India, pervaginal examination is not, it should not be done in a case of a rape victim. Okay, pervaginal examination should not be done. Fine, because what the court is saying is that this again, because she has gone through such a condition and she has come to you, again you are doing a pervaginal examination which is against her fundamental right. Okay, fine. And see, what are the findings you will see? Fingernail scratches, bruising, then spermatova, any venereal diseases, hymen you have to see. Okay, size of the opening, swab from the surfaces, everything has to be done. Then rape on children, remember hymen is deeply situated. Okay, so the penetration or the rupture of hymen is not possible actually in case of children. So when a child is brought because of rape, you have to always examine the hymen. And remember, hymenal rupture, if the hymen is still rupture, means you have to think about some other causes. Okay, well, because hymen is very unlikely to rupture in the case of child because it is very deeply situated. Okay, fine. So these are the important things you have to remember. And autopsy, all pelvic organs, vagina, vulva, anus, everything has to be completely transferred into blocked tissues. For example, if the rape victim is brought dead. Okay, and remember all the sections of IPCs 375, 376 A, B, C, and D. Section 354 also you have to remember. 57 CRPC. Then another is the three important CRPCs that you have to remember is section 164 A CRPC, section 357 C CRPC, and section 53 A CRPC. Okay, the CRPCs, IPC is very important. Date rape drug very important. Rohypnol and GHB, there is gamma hydroxybutyrate, ketamine. Okay, all this are the date rape drugs. The most common is rohypnol or flunitrazepam, which is a benzodiazepine analog. And the next is okay, what do you mean by statutory rape? Examination of the victim. So this finishes the important topics which comes under the sexual offences part 1. In the next thing, we'll be seeing the examination of the accused. We'll be seeing the unnatural sexual offences, sexual perversions, and the other sexual related offences. So with this, I'm winding up my video session. Thank you.